The thyroid is a butterfly-shaped organ located in the neck right here below the thyroid cartilage. It's responsible for producing thyroid hormones, which regulates metabolism, growth, and development. Put a wrench in this intricate system, and a lot of different things can happen. For example, if a patient begins leaking hormone due to a condition called subacute thyroiditis, which is inflammation of the thyroid, they can suffer several unpleasant symptoms.
So a patient may have pain in the area of the thyroid. They may have referred pain to the jaw or referred pain to the ear and not even realize that it is due to the thyroid. Because the gland moves with swallowing, the pain may in fact be just that the patient notices that it hurts when they swallow, and many people have thought they had a sore throat. The other way is they may present with actual signs of inflammation such as fever, and not always is it clear that the fever is from the thyroid, and some people have been worked up for whole other sources of fever. And the third way they may present is due to the overactive thyroid. The gland is now leaking this thyroid hormone into the system and may cause hyperthyroidism.
Subacute thyroiditis often occurs following a viral infection of the upper respiratory tract, such as influenza. We're not always able to identify the offending virus in every case. While subacute thyroiditis often arises after an infection, it's not because the virus is attacking the thyroid. Rather, the body is overzealous in attacking the virus.
It may either look a little bit like the thyroid in some of the cases or in ways that we don't understand, and it tends to then, instead of just making antibodies against the virus, make some sort of attack on its own thyroid. So it is in the recovery phase generally of the virus, not in the actual having of the virus itself, that as one is fighting off the virus, one attacks its own thyroid.
Diagnosing subacute thyroiditis involves piecing together a puzzle of evidence. First, there are the patient's medical history, a clinical exam, and detectable symptoms. Laboratory tests can reveal if there is an abundance of thyroid hormone in the bloodstream. A nuclear scan of the thyroid evaluates the function of the thyroid, which will reveal that the gland is not making excess thyroid hormone, but leaking hormone into the bloodstream. There we have our answer.
When the cause is a subacute thyroiditis, there is no medication we can do to decrease the level of thyroid hormone in the body, since again, the gland is not making it, it is leaking it. So we give what's called supportive care. We can give medication to slow down the heart, the same beta blocker that we would give for the hyperfunctioning thyroid gland. If the gland hurts, we give anti-inflammatories, and very rarely, if the pain is significant and not getting better with the anti-inflammatories, we will give steroids such as prednisone to improve the discomfort that's due to the subacute thyroiditis.
Most patients achieve full recovery from the condition. A few patients may continue to have hyperthyroidism, but that's a condition we can monitor and manage as well. There isn't anything you can do to prevent developing subacute thyroiditis, but it's always a good idea to be up to date on your vaccinations. If you don't catch that initial viral infection, you should not develop subacute thyroiditis. If you do fall ill, be sure to have medical attention along the way. Another pair of watching eyes can potentially detect subacute thyroiditis early on. I'm Dr. Mike Rosen, and you're watching the eHealth Network. Stay healthy.